Dr. Jamila, Dave, welcome. Dr. Jamila, to you first. How is climate change affecting health, access to healthcare now? What are we seeing?
Yeah, that's a really important question. First of all, the impact of climate change on people's lives are both direct and indirect. So directly, we've seen, for example, the recent heat waves during the summer time, where people have actually died as a result. You know, countries that may have not been expecting heat waves have not adapted to dealing with heat. On top of that, obviously, floods, cyclones have also affected people's life directly. Some have been drowned, some have been killed directly. Homes have been demolished because of disasters. So those are, sort of some examples of direct impacts. The indirect ones are also multifold. For example, we know that with climate change, there's a different pattern of disease, particularly vector-borne diseases. So you will see rising cases of dengue fever, Zika virus, malaria even. So much so that there has been a reported case of malaria in Washington, D.C., of someone who's never traveled, or the rise of cases of dengue fever in Texas. So, so these changing patterns also means that the frequency of us getting, these vector-borne diseases will increase. And you know what happened when we got COVID and the pandemic. So, these are the things that will happen. Now, on top of that, there are also other health impacts. For example, mental health, which is not talked about enough. Young people, older people are all affected directly and indirectly by climate change, and there has been serious pressure on mental health. There have also been problems of undernutrition, because climate change also affects the quality of food we grow and the quantity of crops that can grow. So there'll be a long-term impact on the food and nutrition sector as well. So I think, it's a multitude of areas where health is impacted, and for sure, the link between climate change and health is now something real, something that we need to speak out louder about and educate people.
So clearly a big link between the health of our planet and our own health. But I imagine as the health of our planet sort of gets worse, so will ours, and the situation will get worse.
Yeah, no, absolutely, Georgie. And, if you think about it, even in the best of times, in developing economies, getting good access to health, good nutrition, well-being is already a challenge. Now, if you think about what we have ahead of us, with the changing climatic patterns, the increased heat, the stress on water systems, the stress on food systems, we're going to see a lot more of this, a lot more frequently, and a lot more widespread. So really the time to act and put it at the top of decision-making priority is one for all of us to take.
So it leads to the question, what on earth can we do about it?
Yeah, added to that as well, you rightly pointed out, Dave, the rising cost to the health sector is going to be immense, right? From direct damage to, the things that you need to cope with. I remember my friends in the US saying to me, they wish they were in Asia because people didn't know about tropical diseases there. So how, there's so much new things that have to be developed. But I think, as someone who's set up a Planetary Health Center, this is where I think it's time to connect the dots. So Planetary Health, emerged out of, physicians and scientists coming together to say, hang on a minute, there is a direct link between human health and the health of human civilization with the natural systems on which we depend. And therefore, we cannot be healthy without the health of the planet. And what it requires then is for us to re-look at health as well. Often when you think about health, you think about a hospital, a doctor, a clinic. But actually, the determinants of health are economic, social, behavioral, political, and definitely environmental. So Planetary Health allows us to look at it from a systems approach. What are the systems shifts that need to happen for us to have the health of humanity and the health of the planet preserved?
No, very, very much on the same light, Jamila. At this stage, there needs to be the best of climate science, the best of available data, to the right decision makers, to make sense of the issues, right? To have a view of what are the implications across all the different aspects of how we live and work, and using that as a way to then prioritize and deploy resources and act.
Yeah.
I think that really is the immediate agenda that I feel is
But if
important.
I may, it must start from clear communications. When you say, when you talk about climate change in terms of 1.5 degrees, it doesn't mean anything to people on the street. So this is why, the planetary health approach, putting health at the center of our climate discussions is critical. Everyone understands health. Everyone knows that they want good health, right? So if you say to them that if you want to remain healthy, climate change becomes a critical issue, and we need to now address all the underlying drivers on why we are in this situation today. Then you can center your discussions and language that is understood easily. We have to de-jargonize science, right, and make it understood to people.
Who's you? Scientists? Politicians?
Everyone.
Businesses?
Everyone. Scientists number one, because, the reports are coming out from the scientists. Clinicians, doctors, we all have to talk about it. The challenge is this, as a doctor myself, only less than 15% of medical curriculum touch on climate change. And it hasn't changed since I graduated many, many, many years ago, right? Now, the other thing is, the health sector itself is a polluter. If the health industry worldwide was a country, it would be the 5th largest emitter in the world. Health practitioners and health workers are trusted. Our voice matters, and we need to raise our voice, whether it's to our patients, to our policy makers, to our politicians. We need to now really use that momentum from this COP28 that has finally put health as a central agenda to the climate discussions to propel the dialogue, the advocacy, and the action that needs to follow.
Dr. Shmila, Dave, thank you so much.
Thank you.
Thanks.